Afternoon to everyone who has joined us today and will be watching us on YouTube afterwards. Uh, as part of World Sight Day celebrations, I am thankful to Santon Pharma for giving me this opportunity to have a patient awareness program on the different types of common eye diseases and how to best take care of your eyesight. I am Dr. Vishnu Suryaprakash. I am a consultant ophthalmologist at Vishnu Eye Clinic, Chennai. And over the next half an hour or so, I'll be giving you a brief overview about different eye diseases, the common ones that you might encounter, and how to best take care of your eyes. When we look at vision, of all the five senses, vision, I would like to say, is the most important, because vision, without vision, we are nothing. Imagine yourself blindfolded for even an hour, and you will feel that you are almost handicapped. Without vision, you can't see. It's very difficult to put a face to a person. It's very difficult to connect with others and very difficult to feel the joy in the moment. And most of our memories that we make during a lifetime all are associated with vision in one form or the other. So without vision, we would have nothing. So it's very important that we take good care of it. What is World Sight Day? Now, World Sight Day is a yearly event, which is usually the date is celebrated on the second Thursday in October. And around the World Sight Day, the week and a week after World Sight Day and a week before, a lot of awareness is created in print and other media to help draw awareness to the common eye conditions which can cause visual impairment, blindness, and further give patients more awareness on how to take care of their eyes. So as a few sobering statistics, globally, almost 2.2 billion people have some sort of an addressed visual impairment or suffer from some part of blindness, either total or partial. And among these, 1 billion people have some visual impairment which could have easily been avoided and is still not addressed. And as per a recent survey, almost 2% of India's population is blind. Now, among these blind people, about 1.1 million people in India are blind due to corneal conditions. Now, corneal conditions can be treated by means of corneal transplants, and almost 100,000 corneal transplants are required annually in India. But the current number of transplants being done is only about 25,000, which is almost 1/4 of what needs to be done. And this is primarily due to lack of donor tissue, which means that more people need to donate eyes after they die. So when you look at sight itself, the sight is the actual vision that we see. The image falls off an object and is perceived by the eye. And once this image travels to the brain understands its interpretation and its significance, and that is what we call vision. So protecting your eyes is important to maintain this gift of vision. Now, to give you a short anatomy to help you understand the different eye diseases better, I'm going to talk about the eye as such. The eyeball is very similar to a camera, which is what I have most of the patients. In front, you have here the transparent cornea. The cornea is something like the protective cover in a camera. So behind the cornea inside, you have the lens, which is similar to the lens in a camera. And at the very back of the eye, you have the retina. Now, the retina is something which forms the same function as a film in a camera. So you have the light rays entering the eye from the anterior part, which get focused by the lens, and then the image falls on the retina. Once it falls on the retina, the signal is converted into a signal that is carried from the eye to the brain via the optic nerve. Now, here, if you see a cross section, this is the transparent cornea, and behind which the front chamber of the eye, which is filled with a clear fluid called aqueous humor, behind which you have the iris, which gives color to the eye. Central iris has a small opening, which is called a pupil. Behind the pupil, you have the lens, and behind that is the retina. The space between the lens and the retina is filled with a jelly called vitreous. Now, what are the common eye conditions that you would most likely encounter among maybe yourself, your family, and close relatives? Most commonly that we see is refractive errors. Now, the different types of refractive errors are myopia, hyperopia, and astigmatism. Dry eye is quite common, especially in the current generation where there's a lot of gadget usage, which causes also digital strain. Allergic conjunctivitis, color blindness, night blindness are also common. In children, the most common one that you would likely encounter, we as ophthalmologists encounter, is one, squint eyes, where you have one eye looking in one direction, the other eye looking in another direction. Ptosis, where there is a drooping of an eyelid. And what we call amblyopia or lazy eye, in which only one eye is seeing the vision that you're supposed to see and the other eye is having a suboptimal vision. In the elderly age group and in middle-aged people, what we normally see is presbyopia, in which what we say people require reading glasses up to the age of 40. Cataract is something that I think everyone should have heard of. Glaucoma is something called eye pressure. I will deal with it in more detail as we go on. Age-related macular degeneration, which affects the retina, as well as with the current, I would almost say, epidemic of diabetes. Diabetic retinopathy is also turning out to be quite a major important reason for vision loss among the elderly population. So when you look at myopia, this is the most common refractive error which is seen in children. In myopia, what happens is the light rays, instead of coming to focus exactly on the retina, come to focus in front of the retina. So because of this, these kids who have myopia usually can see near objects quite well, which means that they could read books and see close objects or play quite well, but they can't really see distance well. So when they start going to school, they may complain that they're not able to see the blackboard quite clearly, and this requires treatment. So how do you sort of think that maybe my child has myopia? One, you might notice that they are sort of squeezing their eyes and see what we call squinting. They might complain of frequent headaches, and the only way to treat myopia is by using prescription glasses. Of course, as people get older, maybe after the age of 18 or maybe even in high school, you can try contact lenses, and surgery is also an option by means of laser correction after the age of 18 once the powers have stabilized. Hyperopia or farsightedness is an eye condition in which people see distant objects quite well, but they really can't read. And this is something that happens because of age. The ciliary muscle in the eye starts losing its tone and is no longer able to focus as well as what it was doing before. So after the age of 35, 40, most adults require some sort of reading glasses in order to see near objects. So treatment again, most people require prescription glasses, most likely only for reading, and people who don't want to wear glasses, contact lenses are also an option. Coming to amblyopia, what I discussed earlier as lazy eye. In amblyopia, for example, if a child has one eye with, say, squinting and the other eye is normal, the eye which is looking straight has good vision, whereas the eye which is squinting has suboptimal vision. So when this signal goes from the eye to the brain sort of suppresses the eye which does not have a clear image and only takes the image of the eye which sees clearly. So the child actually does not even complain, because when both eyes are open, can see quite clearly with the eye that is seeing well, because it compensates for the other eye. But when you close the eye and see, the lazy eye has lower vision. Now, this is something that needs to be detected early and treated. If not, this lazy eye issue is likely to remain with that kid throughout. So early diagnosis is most important, and usually the treatment is either in terms of patching or some sort of exercises to strengthen the eye that is weak. Now, when we come to the third type of refractive error, I talked about myopia and hyperopia. The third type of refractive error, less common, is called astigmatism. Now, astigmatism or cylindrical powers is something that you might have come across when reading a prescription. You might have noticed there's a column for spherical and there's a column for cylindrical powers. Now, cylindrical powers occur because if you notice this front portion of the eye, right, the cornea, when you take it as a cross section, the cornea should be perfectly hemispherical or round. Like if you take a ball and shave the top off, how it's perfectly round, that's how the cornea should be. But in some people, whenever they are born as a birth defect or by a little bit of genetics is also involved here, this cornea is not perfectly round, it's more elliptical. When that happens, the vertical curvatures and the horizontal curvatures do not match. And in that case, they have astigmatism. Now, people with astigmatism can also see well, but they aren't seeing the actual sharp image that you should see. So over a period of time, they tend to develop headaches, eye strain, they tend to squint again, and they have difficulty driving because they can't see distant objects quite well. And again, for astigmatism, the treatment is either wearing glasses, contact lenses, or sometimes surgery can also be done. Another common eye disease in children that you see is squinting. Squinting or cross-eyed is what we see when some kids, when they are born itself, one eye looks straight, but the other eye looks up, down, left, or right. There is some amount of misalignment. Now, normally for both eyes to look straight, the muscles of the eye need to be in perfect coordination. That is, the muscle of the right eye and the muscle of the left eye need to align the eyes straight so that both eyes see the same object. But when there is some amount of dysfunction in these muscles, one eye turns either inwards, outwards, upwards, or downwards. Now, this will require treatment. Treatment can be done either with eye muscle surgery, again by eye exercises, or sometimes can be treated by wearing glasses itself. So many areas in India, there's a superstition that squinting is like a sign, which means that the child is blessed, and so they don't take treatment for this. I would strongly advise against not doing that. And definitely, you should visit the ophthalmologist at the earliest if someone known to you has a squint. Ptosis or a droopy eye is a less common condition in which by birth itself, one eye slightly droops. So the one eye is wide open, but the other eye is closed. And this is usually hereditary. Some kids are born with ptosis. And unfortunately, this does not get better with time. Most of the time, for a ptosis, if the eye is completely closed, it will definitely require a surgery because otherwise that eye will not develop as well. And for cosmetic reasons also, as the child grows up, you will require a surgery so that both eyes look uniform. This is something, conjunctivitis, something that I think everybody should have got at least once or twice in their life. So conjunctivitis, or what we call Madras eye colloquially, is something that happens when the eyes become blood red, congested. The complete white portion, that is the conjunctiva of the eye, the blood vessels become engorged and it appears reddish or pink. Most patients have some sort of itchiness or grittiness, some amount of discharge occurs. Usually the eyes are crusted or stuck together in the morning when they get up. And this is commonly caused either due to an infection or an allergy. Infections can be because of bacteria or viruses, and allergies can be due to a host of reasons, either because of dust or pollen or any other thing that could cause an allergy. Now, Madras eye or pink eye conjunctivitis is, however, contagious and it can spread from person to person. So, whenever someone is diagnosed with Madras eye or conjunctivitis, it is essential that they maintain good hygiene. Hand hygiene is very important. Make sure you wash your hands after each time after you touch the eye, each time after you put drops. Make sure others who come into contact with you or put the drops for you also wash their hands immediately after instilling the drops for you. These infections usually get better within a week or 2 weeks time. They require some sort of antibiotic drops or lubricant drops to keep the eyes moist or to relieve you of your symptoms that you might have, like itching or grittiness. Everyone would have heard of cataracts. Cataracts is something that most people, almost 80 to 90% of people, develop as they grow old. The only thing that is variable is the age at which you get cataracts. Some people develop cataract much earlier in life, whereas some people develop it later, but it's part of the natural aging. So everybody will develop a cataract at some point or the other. Now, cataract, basically what happens is the lens inside the eye, which is usually transparent or crystal clear, becomes fogged up or whitish as you age, something very similar to how your hair turns gray as you age. So as this lens becomes cloudy, the image that you see also starts becoming cloudy because you are seeing through a cloudy lens. It is like having a spectacle which is scratched and you're trying to see through that, everything appears misty. So most patients with cataract, initially they complain of glare, most commonly at night time when they drive. They also see halos around light. The entire vision appears foggy or misty. The color contrast that they normally see, the vibrant colors, usually appear dull or muted. Cataracts can also be caused as a side effect of some medications. It can happen earlier in patients who are diabetics or hypertensives, and it can happen due to exposure due to ultraviolet light or some chemicals as well. In the early stages of cataract, you can give glasses to help with the refractive error. It will help to an extent, but as the cataract increases and the stage comes that even the glasses do not give you good vision, it's probably time to go in for a surgery. So whenever you have blurred vision, clouded vision, or dim vision, it's probably time for a cataract surgery. In a cataract surgery, basically what's done is by means of an ultrasonic probe called the phacoemulsifier, the lens inside the eye is emulsified and sucked out of the eye and replaced with the artificial lens. The artificial lens is an acrylic material. It is biocompatible and so will remain in your eye for the rest of your life without causing any allergic reaction whatsoever. So if you know someone who's going in for a cataract surgery, or if you yourself require a cataract surgery in the future, you should probably know what to expect. One, what the doctor is probably going to do is they're going to remove your natural lens by the means of the phaco emulsification that I just showed you earlier and replace it with an artificial lens inside the eye, what we call an intraocular lens. In this cataract surgery, nowadays modern cataract surgery is done as a day care procedure, which means that you do not need to get admitted to the hospital. You come in the morning, get the surgery done, and by afternoon or half day later, you're back home. Most cataract surgeries today are done under topical anesthesia, which means the injection that is given to block the eye, as in to give anesthesia, also is not required in a cooperative patient. Eye drops usually are sufficient. Healing is almost 50% complete within a week's time, and in about 4 weeks' time to 8 weeks' time, your healing is completely normal. You can go back to your normal routine. Another disease that most of you would have probably come across is glaucoma. Now, glaucoma is a condition in which the eye pressure causes some amount of damage on the optic nerve, that is the posterior most part of the eye. The optic nerve is highly sensitive to pressure. Now, think of the eye like a football. Just like how a football is filled with air, the eye is filled with a fluid. Now, this fluid can have a pressure, going up, going down, just like how you have a blood pressure which goes up and down. If the pressure goes up and remains up, what can happen is it can cause an effect on this optic nerve, and this pressure build-up on the optic nerve can cause the blood supply of this optic nerve to slowly come down. And this process happens over a period of many years. It does not happen overnight or over a period of months. So when this happens, most patients do not have any inkling that they have anything wrong with their eyes. Most patients with glaucoma are detected incidentally when they come to the doctor for a regular eye checkup. When the pressures are tested or when the optic nerve is tested, they are found to have glaucoma. So unless you do a regular yearly checkup, it's very difficult to catch conditions like glaucoma at an early stage, because unfortunately glaucoma is irreversible. Whenever we treat glaucoma, we only can prevent the damage which happens to your vision from going worse, but really it's very difficult to salvage what vision has already been lost. Now, in glaucoma, what happens if the normal field of vision, when we talk about field, we mean the peripheral field of vision. That is, you not only see the central part of the vision, but you also see the peripheries. Now, this peripheral field of vision slowly starts contracting. In glaucoma, the side peripheral vision slowly starts coming down till the end stage of glaucoma, when it's almost as if you are looking through a tunnel. So, what are the risk factors for glaucoma? Having a strong family history, someone with glaucoma in the family means that you're more likely to get glaucoma. People over the age of 60 always keep a yearly check for glaucoma. Having certain medical conditions like diabetes, heart disease, and high blood pressure can also cause glaucoma. Having had an eye injury in the past, or being extremely nearsighted or farsighted, as in having high hyperopia or high myopia, also are risk factors for glaucoma. Some drugs that you might take for other reasons, like especially corticosteroid medication, can also cause glaucoma. So when you go to a doctor for a glaucoma evaluation, what the glaucoma doctor is going to test is, one, they will test your eye pressures. This is called tonometry. So when you check the eye pressures, normal pressures are about 15 to 18, and depending upon how much your optic nerve is damaged, the doctor is likely to fix a target, as in what the eye pressures should be once you put the medications, and he's likely to follow you up at regular intervals after that. Measures the eye drainage angle, that is the gonioscopy, in which you see the fluid entering the eye, whether the passage for it to go out of the eye is open. Doctor will most likely examine your optic nerve to see how much it is affected, and will also do a test called a perimetry, in which the side vision is assessed to see how much of side or peripheral vision you have already lost. Now, most of the treatment in glaucoma is with eye drops. Today, with the different types of eye drops, and the eye drops are quite effective these days, most patients can be treated well for glaucoma with drops alone, and most of the other options are really rarely needed, if at all. So these eye drops would, however, need to be used on a regular basis. Eye drops, unfortunately, are not a cure. They only reduce the pressure. So the effect of the eye drops lasts only as long as you use them. So drops, just like BP medication or sugar medication, are something that you will need to use lifelong once you start the eye drops. If at all eye drops don't work or eye drops are not sufficient to bring your pressures down enough, patients might also require either laser therapy, and some cases might also need to go in for surgeries. Now, age-related macular degeneration is something that is one of the most important causes of blindness, especially in developed countries, and is in India as well is slowly starting to increase. Macular degeneration is a condition in which the retina, especially the central part, what we call the macula, starts undergoing a degenerative process. Now, this degeneration affects the central vision, and so people start seeing central vision, which is blurry. It's not something that is going to make you blind, but definitely will cause visual impairment in the sense that you might not be able to see your TV or read books comfortably. People find it hard to recognize faces or perform other normal activities. And if again, there is a bit of a hereditary risk factor to this. So if you know someone in your immediate family who suffers from age-related macular degeneration, you should also get it checked. Smoking and obesity also can predispose to this. In age-related macular degeneration itself, there are two types. You have a dry type, which is the commonest, and a wet type. Now, the dry type is something that doesn't require much treatment apart from giving nutritional supplements to the retina, but in a wet type, treatments are available as in we give injections in the eye to treat the macular degeneration. If you have an ARMD, the doctor will most likely do something called an optical coherence tomography. It is a scan of the cross section of the retina in which he will see the layers, see at which layer the degeneration is happening, and accordingly will let you know whether you require any treatment in the form of injections or whether tablets will suffice. A fluorescent angiography is sometimes required, in which dye is injected into the hand and some serial photographs of the eye are taken, which help to detect the amount of disease that you actually have. With the current, I would say, epidemic of diabetes in India, diabetic retinopathy is fast progressing into one of the commonest causes of blindness. Now, in diabetes, what happens is the entire body is affected. As you know, a person with diabetes can have kidney issues, can have eye issues, can have issues with nerves, and so on. In the eyes, the posterior portion of the eye, that is the retina, has small capillaries. These capillaries supply blood to the retina. And what happens in diabetes, there is some amount of leakage or bleeding that happens in these capillaries, and this causes fluid to stagnate within the layers of the eye and can also cause bleeding within the eye itself. In diabetes, people might start having vision which is blurry. Either the complete vision becomes blurry or parts of it become blurry, and eventually, if untreated, sometimes can become as worse as cause blindness as well. The amount of diabetic retinopathy that a person usually can develop is almost directly related to his sugar control. If the sugars are in good control, the chance of developing diabetic retinopathy is very minimal. But however, the sugars are fluctuating, or if there is a very high sugars, glycosylated hemoglobin, that is HbA1c, more than 7 or 8, then the chance of you getting diabetic retinopathy is much more. You might have blurred vision, fluctuating vision. You might see some dark or empty areas in the vision. Now, if you're having diabetic retinopathy, it is mandatory that you get yourself checked yearly. Anybody with diabetes also should get your check yearly, because when this condition is detected early, the treatment options are definitely much more beneficial than if detected late, when they don't really work as well. Early treatment will allow your ophthalmologist to treat it either with laser or with injections in the eye to control the diabetes. Of course, sugar control is also important and needs to go hand in hand with the treatment that is also being given for your eyes. With today's world, where everyone is watching a lot of computers, spending a lot of time on mobile devices, social media, on TV, eye strain is something that is becoming a very, very common complaint, especially among the younger people. Eye strain is a group of symptoms. It's not a particular symptom, but the entire eyes are uncomfortable, feels heavy, you can have some amount of itching, watering, strain, or headaches when you use the computer or TV, and usually annoying. So however, it usually goes away when you take rest. put some eye drops, something like a lubricant, give rest to the eyes, and take some general vitamins, which will also help in this. Most important than anything else in reducing eye strain is to decrease the amount of time that you spend on the screen. All gadgets, however, whether it be computer, tablets, cell phones, all are equally to blame for eye strain. So when you look at eye strain, the common complaints that most people have is eye irritation, blurred vision, they have some sort of stinging sensation, might have watering, redness, frequent headaches, and difficulty in focusing. Now, especially in the past 6 months, the number of people walking into the doctor's office, especially in ophthalmologist's office for eye strain, has become multiple fold as compared to before. This because more people are watching more TV. Work from home means that more people are spending more time on the computers, more social media, smartphone use, all is contributing to eye strain. A few tips to take care of your vision when you use the computer for long. One is practice safe eye distancing. Keep your computer screen or your laptop screen at least about 2 feet from your eyes so that the amount of glare from the computer screen is less. Keep the brightness to a comfortable level, need not be overly bright, one that is comfortable for you to work. Follow the 20-20 rule. That means for every 20 minutes that you work on a computer, you need to give your eyes some rest. Focus on something far away, at least 20 feet away, and focus on it for 20 seconds. Wash your eyes regularly. Use nighttime settings when you are using the cell phone so that the amount of blue light exposure, which is thought to further worsen eye strain to the minimum. Consider turning off some of the overhead lights when working on the laptop or desktop and blink more often. Whenever you focus on the computer for a long time, what happens is by reflex, you tend to strain and keep your eyes open. So you blink less often, and that is one of the common causes of dryness and eye strain when you look at computers for long duration. So what can be not be stressed enough is that you need to have regular eye checkups. A checkup does not only mean a power checkup at the opticians, it means a comprehensive checkup. Not only the powers need to be checked, but you also need to have a dilated exam in which the doctor will put an eye drops, wait for the drops to work, and will have a look at the inner retina of the eye, the optic nerve of the eye. Regular eye exam helps to detect conditions like cataract, glaucoma, diabetic retinopathy, and others at an early age when they are more amenable to treatment. Regular eye checkups, I think, are a must, and that is something that you should do at least once a year. Children between the ages of maybe 3 to 10 require a checkup at least once every 2 years, even if they don't have power, because in case they develop any eye powers, either myopia or agerelated, they might need to start wearing glasses. If there is no other symptom of any family history of eye diseases, a yearly checkup, I think, is sufficient for most people. And finally, I would like to end this presentation by asking you to take a pledge to make sure that you sign up on this website and pledge to donate your eyes so that after you, at least 2 more people can see with your same eyes. Thank you so much for your patience. And if anybody has any questions or would like some doubts clarified, please feel free to ask me. I'm here to answer them.
Yeah, sir. Participant asked the questions to you, which is in chat, sir. Is it advisable to check eye power in spectacle shop?
Yes, spectacle shops also check eye powers. If you're just going in for a regular power check and you want to change the frame or change the lens, it is perfectly okay to go to a spectacle shop and check your power and make a new pair of glasses. But it is not a replacement for your yearly mandatory eye checkup, because the doctor will also look at many other things other than your power alone. He will look at the inside of your eye, your retina, your eye pressures, the optic nerve, and so on. So yes, if you just want to go in and change your glasses, spectacle shop and checking it and changing your glasses is perfectly fine. But you should also have a yearly checkup.
Next question is, sir, thank you so much for giving a valuable answer, sir. The next question is, does all doctors do regular eye pressure checkup? If one diagnosed with glaucoma, how long medicine to be taken, sir?
Yes, all ophthalmologists, when you go in for a checkup, will and should check your eye pressure at every visit. Eye pressure is part of your yearly screening that you do, just like when you go to a physician, he will check your blood pressure and make sure it's normal. So the same way, when you go to an ophthalmologist, the eye pressure should also be checked yearly. And if you should be diagnosed with glaucoma and the doctor has started you on eye drops, the drops unfortunately need to be used lifelong. So the drops will only work as long as you use them, and the effect of the pressure reduction, because the drops only work as long as you use the drops. So once you stop the drops, the pressure will go up again. So unless the doctor specifically advises you to stop the medication or to switch over to an alternate medication, you should continue to use the drops.
Thank you so much, sir. Yeah, no, there are not any other questions, sir. Thank you so much, sir.
Thank you. Thank you so much again for taking the time off to come and listen to my talk. And I hope that everyone took away at least 1 or 2 points about eye health. And I hope that some amount of awareness so that you can spread it among your family and friends as well. And make sure that you have a yearly eye checkup. It definitely should be done for everyone. Thank you so much.